Dr. Hemant.
Good morning, everyone. I will be talking on the clinical outcomes of minor salivary gland transplantation for severe dry eyes secondary to chronic Stevens-Johnson syndrome. We will be going through the introduction. As we all know, SJS is a complex immunological disorder involving total body surface area less than 10% and predominantly involving oral mucosa and conjunctiva. It is an MB-spective interventional case series done at RP Center of Ophthalmic Sciences, AIMS, New Delhi. All the patients with chronic SJS having severe dry eyes, severe aqueous deficiency, the Schummer scores less than 5, and in the bilateral patients, the worst eye was taken, and minimum follow-up was 1 year post-surgery. All the active infective patients, ulcerated patients, perforated patients were excluded from the study. It is a short video, which I will be showing later. In the post-operative medications, moxifloxacin, prednisolone, and lubricants were given, and betadine and chlorhexidine gargles were given. Coming to the results, the mean age of patients in the study was 28.6 years. There was 12 female and 8 male patients, and 60% of the patients found allergic to antipyretics or analgesics. Other causative agents included anti-epileptic drugs, anti-tubercular treatment, and 10% patients had unilateral ocular involvement. Maximum patients were having the disease duration of in between 5 to 10 years. There were 6 patients who have the duration for the less than 5 years and 4 patients between 10 to 15 years. All the patients showed significant improvement in BCVA, Schummer score, hyperemia score, keratinization score, and SPK score. The p-value was very significant, all was less than 0.05. It is a post-operative image at 1 year of follow-up with improved corneal transparency and wettability and reduced neovascularization and keratinization. Again, it is a clinical photograph of patient showing both pre-operative, it is a dry surface, there is a lot of keratinization, and in post-operative phase, there is improved wettability, and we can see cornea a lot better. We can see the improved lubrication in the eye, degrees of superficial punctate keratitis or epithelial defect. Hyperemia was significantly reduced in these patients. The advantage of minor salivary gland transplantation include this procedure improves wettability, reduces inflammation. We can see the improved Schummers, reduced hyperemia, reduced conjunctivalization, neovascularization, and corneal opacity score. Biosimilarity of TS and saliva with conjunctival oral mucosa leads to lower immunological reactions. And there is easy availability and easy accessibility and universal availability of the process. And there is low risk of allogenic rejection as it is an autologous graft. Limitation of my study include lack of subjective evaluation and quality of life analysis, and there is lack of immunohistochemistry to demonstrate the viability of transplanted glands. So minor salivary gland transplantation is a viable and effective treatment option for cases of severe dry eyes secondary to Stevens-Johnson syndrome. In future, the randomized study could enhance our understanding and applicability of MSGT in managing severe dry eyes secondary to chronic SJS. SJS is not a common disorder with many variables in natural history of the disease. Thus, conducting a randomized study in this patient may be extremely challenging. Here are the references for my study. I will be going back to the video and showing it to you. So the excision area of the lower labial mucosa was marked approximately 15 cross 15 mm, and it was infiltrated with 1 to 2 ml of 2% lignocaine, and the superficial incision was given with the help of 15 number blade. Deeper dissection was carried out using the scissors, and we explanted the gland. Minimum 12 to 15 number of acini should be present. After that, we opened the conjunctiva and placed the gland and secured it with 6-0 silk and 9-0 proline suture. Thank you.